From VTV Channel 6 Studios in downtown Vernal, this is Local Point with your host, Chris Piner.
Hello there, everyone. Welcome to Local Point, sponsored by Ashley Regional Medical Center. I'm David Gale in for Chris Piner today. Recently, a UNO high school football game was postponed. You may have heard about it. It's about 20% of the student body was out of school with flu-like symptoms. This time of year, the common cold goes around, but today it's tough to tell the difference between the regular flu and the H1N1 virus, commonly called swine flu. Here in the UNO Basin, you won't be tested for H1N1 unless you're hospitalized. How come? Well, we're going to talk about it today. During the segment, we welcome into the studio Jeramie Tubbs, Public Information Officer of the Tricounty Health Department. Thanks for joining us today.
Thank you for having us.
Now, first, let's talk about this incident that happened at UNO High School here. 20% of the student body gets sick all of a sudden, wham, all at once. Is this the flu? Is it something else? Is it something to be concerned about?
You know, they really didn't know what it was. It hit the student body so quickly. You had about 80% of the football team experiencing the same symptoms. I spoke with Principal Wild. They didn't want to expose outside teams and travelers coming in and then possibly picking up whatever bug this is and spreading it further through the state. So they made the call to cancel the game. Since then, the absenteeism levels at the high school have dropped dramatically down, you know, to where it's not such a panicked level.
Right. Well,
yes.
Could it have been the swine flu?
We have positive confirmation of one high school student that has been specifically typed for H1N1. We do have 5 cases reported here in the Basin that we've received confirmation from the state laboratory. Generally, as you said, they aren't testing in the clinics and things. They may be testing for type A, but not specifically for H1N1. There are 3 strains of the type A. One of them is H1N1. The other 2 are just regular seasonal flus that are circulating at this time.
So we do have the flu that's circulating right now.
Yes.
You know, we have this name associated, swine flu, and that kind of brings up these feelings of, oh no, it's the swine flu.
Right.
What is the difference between your regular seasonal flu and swine flu?
Just a little different strain, but basically you're just dealing with the flu.
It's just the flu.
Basically.
So when you go in and you get your shot, your flu shot, I know that they make these flu shots specifically for certain strains. And when the swine flu epidemic suddenly was this big concern, they start, you know, pumping out, let's start making them, but it takes a few months. So are the flu shots we're getting now, are they for swine flu? Are they for regular flu? Is there a difference?
The shots that they have out now for seasonal flu cover the 3 main types that they have seen across the hemisphere in earlier seasons.
Okay.
And they do not protect against H1N1. Okay. That one is being manufactured specifically to address swine flu. So if you're at a high risk for flu complications, you're probably going to, you know, consider getting both immunizations.
The best thing probably is preventative measures. So what do we do? I mean, we want to get the shots, great, but what do we do to keep from getting it to start with?
Right. Well, first and foremost is to get your vaccination.
Right.
Second thing is your everyday preventative measures. If you have a cough or a sneeze, sneeze or cough into your sleeve, use a tissue, dispose of it immediately. Wash your hands constantly. Just be so aware. Keep them away from your face. Touching your eyes, your nose, your mouth lets those viruses enter into your system and can cause you to get ill. Social distancing is another one. I mean, if you're sick with a fever and a cough or such, you really should stay home. Don't go out shopping. Don't go to church activities. Don't, you know, kind of isolate yourself. If you are around someone else who is sick, social distancing, you know, 3-4 feet away, that's great, you know. Keep contact to a minimum. And if you can't get to soap and water, the little hand sanitizers that are just handy pocket size, you know, those are great as well. And that's, you know, pretty much as far as that kind of prevention.
Now, going back to vaccinations, Tri-County Health, you guys provide vaccinations in the form of clinics quite often. What do you have coming up in the near future?
In Roosevelt next Wednesday on the 30th, beginning at 9 o'clock, we're going to do a mass seasonal influenza clinic. We'll be able to provide that shot. So it's just walk-in appointment. Those will be available.
Any idea how soon swine flu or H1N1 vaccinations will be available?
We will be able to begin to order them next week.
Okay.
But it's, you know, kind of a demand and population size.
Right,
We don't
right.
expect to get a tremendous amount in the first ordering. Probably the second one, I think they'll address the more densely populated areas first.
Right. But again, like you say, keep clean. Don't just go hugging everybody you see. Not this time of year anyway. All right. Thank you so much for joining us today. Keep watching. After this word from Ashley Regional Medical Center, you're going to hear how a National Medical Reserve Corps is prepared to help should disaster strike locally. Stay with us. We'll be right back.
Welcome to the CT Suite at Ashley Regional Medical Center. We've recently renovated this area for our new GE Lightspeed VCT scanner, the first of its kind in northeastern Utah. This CT is the next generation of life-saving imaging technology. The new 64-slice CT delivers crystal clear, high-resolution 3D images with breathtaking speed and reduced radiation. Ashley Regional Medical Center, providing technology for the future.
Welcome back, everyone. We've been talking about tips to stay well with the cold and flu season upon us, especially with the swine flu around. We now welcome into the studio Rob Grove, the Medical Reserve Corps Coordinator. Medical Reserve Corps Coordinator, which is a tongue twister in itself. Now, what is the Medical Reserve Corps?
The Medical Reserve Corps is basically a group of volunteers that helps out in times of disaster or times of emergency, and also during times of special events. And Dave, just to kind of tell you how it came about, after the devastation of 9/11, President Bush, in his 2002 State of the Union address, decided that we needed to become better prepared as a nation to act to help our communities in time of emergencies. So that's really how the Medical Reserve Corps really was founded. It actually falls underneath the Citizens Corps. And it's, again, just an organization of volunteers within your local community. The Tricounty Medical Reserve Corps covers the Daggett, Duchesne, and Uintah counties, currently have 55 volunteers. And we basically serve in several different aspects. We participate in community events to help out and do some exercising within community events. But really, the reason the Medical Reserve Corps is here is it is drafted of a lot of people with medical specialties and a lot of other people with non-medical specialties. And in the event of a disaster, let's just say if we were to have a major earthquake, to use as an example, our hospitals, because of the bed space and the size of our hospitals, they would be overcapacitated. Okay? So there would be a great need to service injured people. The Medical Reserve Corps would set up additional triage facilities to actually help these people that the hospitals cannot manage at the particular time.
So this could be any kind of emergency. Like you said, you had an earthquake, but we're talking about the flu. What if we had a major outbreak of swine flu or some other type of flu that really just knocked our population down? What would the Medical Reserve Corps do?
Actually, I'm glad you asked that, because it's not just earthquakes. It's any type of event, any type of pandemic. We actually have our volunteers that are helping and assisting in our flu clinics that are going on right now. When we do get the H1N1 vaccination in, we already have layouts set out where our volunteers are going to assist the general public in greeting these people, giving them information about the H1N1, and actually assisting within our clinics. So great efforts are done by the volunteers, and they help out tremendously in not only major events and major incidents, but all kinds of events.
Well, if it's completely a volunteer-based organization, then you probably are happy to take anyone who's willing to come and help, or is there a cap? Do you guys only take people who have experience in certain medical professions? You said you have people who definitely aren't, so who can get involved and how do they get involved?
And actually, again, we take anybody, okay? The criteria is you do have to be over 18 years of age, okay? We do look for medical specialties, and we do look for anybody that would like to volunteer. For an example, if we were to have a major incident, okay, yes, medical specialties are going to be needed, okay, but there are a lot of other jobs associated with people outside of the medical field. We need traffic control, we need administrators, we need runners. So there's a lot of different, we need people maybe that are bilingual or know American Sign.
That's good.
So there's a lot of different things and job responsibilities that they can do. So we will take all volunteers. you can actually either come to the Tricounty Health Department and just ask for me, Rob Grove, or you can actually call the Tricounty Health Department and ask for me, and I'll be glad to set up an orientation with you. I'll be glad to do presentations to get additional volunteers. Again, 55 volunteers is what Tri-County currently has, and with population of our Tri-County about 41,000, we're looking for more volunteers.
Yeah, definitely, because you're talking about Uintah, Duchesne, and Daggett counties. I mean, that's a huge area for 55 people, you know, to be helping out. I mean, if an emergency happened, we need all the people we can get.
You're exactly correct.
Really quick, your phone number for people to contact you?
My phone number is 435-247-1170.
247-1140?
1170.
1170. Don't listen to me, listen to him. He knows his number. All right. Thank you so much for joining us
Thank
today.
you.
That's it. Again, remember, if you're sick with the cold or the flu, please stay home until you're better. We're out of time. Thanks for joining us on Local Point.